Thank you so very, very much for making that clear. You go through all of these pieces of legislation, and the Democratic caucus is there. On the other side of the aisle, on the Republican side, they're standing with big oil, big banks, consistently, and the big health insurance industry. Yep. Now, let me make this point perhaps more clear, and that is the Republican minority leader not only said that that we ought to take on this issue of Wall Street reform as though it was some sort of a nuclear weapon killing an ant. He also talked about the health care, and he said that if the Republicans control the Congress after this next election, if they win enough seats after this next election, they are to do everything they possibly can to stop the Patient's Bill of Rights and other health reforms. They are out to repeal the reform that that Americans desperately need so they can get affordable health insurance. They want to kill those reforms. They want to turn back that woman's opportunity to get an insurance policy and say, we don't care whether you have a pre-existing condition. You are at the mercy of the health insurance company. If they deny you, that's your problem. You shouldn't have gotten sick in the first place. If you're the 23-year-old, you're going to lose the opportunity to be on your parents' benefits. That's what the Republican caucus wants to do, is to repeal all of the effort to protect consumers and to build into this system a method of keeping us healthy. So, okay, whose side are you on? There is a string here. There is a logic to all of this. One more thing, and I couldn't believe this when I heard this, and it just became, I guess, in the last day or two, Social Security. Now, Social Security is an insurance policy. You and I pay into Social Security as members of Congress. A certain percentage of our pay goes for Social Security, and so it is with every other person in America who is working legally. They are paying into Social Security. Now, Mr. Boehner wants to, the Republican leader has said that what he wants to do is to increase the retirement age to 70, from 65 to 70, and use the savings to finance the Iraq and Afghanistan wars. And I'm going, excuse me, wait a minute. That's my insurance policy. That's my mother's insurance policy. That is the insurance policy of the working men and women out there, and you want to take it away to finance the Afghan war. I don't think so, but that's one more sign, a signpost. We're following a path here, a signpost of where the Republicans stand. Big business, ending Social Security, and in fact, their budget put out by the Republican Study Committee, their budget called for the end of Medicare, privatization of Medicare, Medicaid, and Social Security. That's their policy. If that's what the public wants, then those folks are going to win this election. They're going to come and they're going to control this House, and they're going to try to do it. I think that would be a serious problem for every American. Medicare, Social Security privatized? I don't think so.
Well, the gentleman will yield.